Good morning to everybody. I am Dr. Vinit Shah. I work as a consultant in hepatology, liver diseases, and liver transplantation medicine at Ruby Hall Clinic. We run the liver unit here as a part of Rela Institute at Ruby Hall Clinic. So, tomorrow being the World Hepatitis Day, that is 28th of July, I would like to talk to you something about World Hepatitis Day as well as the importance to identify viral hepatitis. As you all know, World Hepatitis Day is celebrated every year on 28th of July with certain theme. So the theme for this year's World Hepatitis Day, which has been given by WHO, is finding the missing millions. The meaning of this is that there are 290 million people worldwide who are infected with chronic viral hepatitis, that is hepatitis B and hepatitis C. And missing the millions means that unless you test and identify the chronic hepatitis B and chronic hepatitis C, it is not possible to link them to proper care and proper management. So it is very important to test the population more and more, because as in 2016 all the governments had made a pledge to eliminate viral hepatitis by 2030. But somewhere we are finding that this pledge of eliminating viral hepatitis is getting stalled, and one of the main reasons of this getting stalled is lack of testing. So we would like more and more testing so that we find out those missing millions of chronic viral hepatitis and we link them to proper care and management. Now I would be talking to you something about viral hepatitis and overall about hepatitis. So the first question is about what is hepatitis. So hepatitis in layman's term means swelling of the liver. So whenever there is an injury to the liver, there may be any triggering factor. It may be an infectious disease agent as the triggering factor, or non-infectious disease agent as the triggering factor. There is swelling to the liver, and this swelling is manifested clinically either by abdominal pain, loss of appetite, vomiting, yellowness of eyes, that is jaundice, or it may be asymptomatic but may be reflected only when one does a blood test. So that is hepatitis. The main reasons for hepatitis by far are viral hepatitis. So in developing countries, due to poor hygiene and sanitation, hepatitis A and E are the major causes. Hepatitis A being the major cause in the pediatric population, E being one of the major causes in the pregnant population, and the other very important subgroup of viral hepatitis are your hepatitis B and C. Coming to the non-infectious causes of hepatitis, in the major pandemic now all over the world is non-alcoholic fatty liver disease causing non-alcoholic steatohepatitis, and the other important factor is alcoholic liver disease causing alcoholic hepatitis. There are certain rarer causes of hepatitis like autoimmune liver disease or Wilson's disease or rare metabolic conditions which can also cause hepatitis. So this is about hepatitis. Then the next question is about chronic viral hepatitis. So as I explained, the major worry for which the WHO is giving the theme of finding the missing millions is to identify more and more chronic viral hepatitis, mainly in the hepatitis B and hepatitis C. So the major causes of chronic viral hepatitis are hepatitis B and hepatitis C. Coming to the next question, how does hepatitis B and hepatitis C spread? So the major recognized routes of transmission for hepatitis B and hepatitis C are bloodborne. So first we would come to hepatitis B. So the major route of transmission of hepatitis B is vertical transmission. That is, the virus is not identified in the pregnant mother and it gets transmitted to the offspring because it has not been identified in the mother. So this has been recognized as a very important cause. To say the least, it is very easily preventable to transmit this virus, and the most important thing is to test all pregnant ladies for hepatitis B and hepatitis C, and if you identify the pregnant lady who has a chronic viral hepatitis, you can then refer to a proper liver specialist who can guide whether treatment is required for the pregnant lady or not, and also the precautions to be taken during delivery. And very important is timely administration of hepatitis B vaccine and hepatitis B immunoglobulin to the child as soon as possible after birth. And studies have shown that with all these strategies, that is proper treatment of the pregnant mother if required, and giving the vaccines and immunoglobulins to the child immediately after birth, the significant reduction in the transmission of hepatitis B to the child can occur. The other important recognized routes of hepatitis B spread are through blood transfusion of impure or improperly evaluated blood products. Nowadays, there are a lot of immunological products used like albumin or immunoglobulins. Even if the proper precautions are not maintained, hepatitis B can get transmitted through these products. The other routes are sexual intercourse and the sexual route of transmission, and also intravenous drug abuse. A more and more recognized routes is the excessive use of tattooing and cosmetic surgeries, where there are use of lot of needles, and if these are not properly sterilized, then even that can serve as a route for hepatitis B transmission. Coming to hepatitis C transmission, again the modes of transmission are more or less the same as hepatitis B, but the mother to child transmission is a very less likely route of transmission for hepatitis C. For hepatitis C, the major route of transmission is through improper blood products, or in India, especially in states in the northeast and Punjab, it is through use of intravenous drugs which are used with improperly sterilized needles and syringes, and that can cause the transmission. Now coming to detection of viral hepatitis. So as I told you, the hepatitis can be symptomatic, where you have symptoms like yellowness of eyes, abdominal pain, vomiting, loss of appetite, where you go to the doctor and then it can be diagnosed on the basis of blood tests and a sonography. Other is that you are gone for a health checkup, or you are posted for a surgery for some other reason, and you incidentally have a deranged liver function test. So that is also a very important way to detect a viral hepatitis. So any person who has a deranged liver function test, or who is going for surgery and who is having a deranged liver function test, it is important to check the patient for hepatitis B and hepatitis C. The viral hepatitis is mainly diagnosed by rapid tests or ELISA tests, where we detect the antigen in case of hepatitis B, and the hepatitis C we detect the antibodies. There are certain high risk groups for which this testing should be done mandatorily. So the high risk groups being, number one, who are pregnant age group, number two, who are on long term maintenance dialysis. It is a very important subgroup because here you can prevent the hepatitis B by vaccinating the people for dialysis, and hepatitis C by proper precautions. The third important subgroup is those who are going for organ transplant, either bone marrow transplant or solid organ transplant. The fourth important group is the group of retrovirus or HIV positive individuals, who also should be tested for hepatitis B and hepatitis C. So these are the important subgroups where the viral hepatitis testing should be done, and it can be diagnosed by very easily available and very least expensive blood tests. Now coming to the next question, the common symptoms of hepatitis. I already mentioned that the common symptoms of hepatitis are what are known as prodromal symptoms, where there can be low grade fever, joint pain, loss of appetite, vomiting, dull aching abdominal pain. And the extreme symptoms which should alarm you are yellowness of the eyes, loss of consciousness, which may indicate that the liver is failing, and then you need to visit a good hospital with a very good liver unit on urgent priority. Now coming to the treatment of chronic hepatitis, it is very important to identify the insulting agent which is responsible for the hepatitis, following which appropriate treatment can be instituted. So Coming to the treatment of hepatitis A and E, there are no specific drugs available. Giving rest to the liver, taking good nutrition, good diet, hydration, and monitoring for the complications of liver failure is the main treatment strategy for this. For hepatitis B and hepatitis C, you have very good oral drugs available, and now most of these drugs are manufactured in India and are available at very cheap and less expensive prices. Many of the drugs are also available in the government hospital at free of cost basis. So if you identify the patient timely and you institute the treatment properly, you have very good oral medicines available for hepatitis B and C. Coming to the non-infectious causes of hepatitis, for non-alcoholic fatty liver disease, the main strategy is lifestyle modification, which is weight loss and exercise, which can be brought by proper dietary counseling and proper exercise schedule. So this is the most important ways by which non-alcoholic steatohepatitis can be treated. You also have now drugs available which act on the diabetes, as well as some drugs available which directly act on the non-alcoholic steatohepatitis. So with a combination of proper lifestyle modification with proper diet and exercise and weight loss and the drugs in combination, you can treat NASH. For alcoholic hepatitis also, there are no specific drugs available which have shown to have a benefit. Main issue is to stop alcohol, totally cut down alcohol and stop it, totally abstain from it, take very good diet, and by this way you can treat the alcoholic hepatitis as well. Can all viral hepatitis be cured? So the answer is no. Hepatitis A and E are often self-limiting and they get cured as the body develops immunity, as the virus progresses in the body and the body develops immunity against it. Hepatitis B, unfortunately, chronic hepatitis B cannot be cured because the endpoint of cure is to eradicate the virus from the liver cells. But notoriously, hepatitis B goes and sticks into the liver cells, and hence it is impossible to eradicate the virus from the liver cells, and there is no drug which has been invented so far who can does the purpose. But if we keep the viral multiplication in the blood under control and we give the monitoring properly to the patient, then hepatitis B can be kept under control. For hepatitis C, definitely we have very good drugs available, and those drugs can ensure that the virus is suppressed to a level where it is no longer a threat to the body as well as to the liver. Now coming to patients with viral hepatitis, can they live a normal life? Definitely, patients with viral hepatitis definitely can live a normal life with respect to profession, with respect to marriage, with respect to having a child, with respect to education. There is no differentiation by the government in between patients with viral hepatitis and patients without viral hepatitis, and definitely they can lead a normal life and excel in all forms of life without any problem. The complications if hepatitis is not treated, this is the one of the most important thing, that the complications which can happen if the hepatitis is not treated, and hence the WHO this year has given the theme of finding the missing millions, because if we identify them timely, then we can treat them properly, keep them under proper checking and surveillance, and prevent them from progressing to end stage liver disease or the other complications of chronic hepatitis like development of liver tumors. Then who is at high risk? So I already mentioned in my previous description that there are certain groups of population who are at high risk. So number one is any person in the family who is hepatitis B. Detailed family screening of this person's wife, siblings, parents should be done, because we see that by proper family screening we are able to identify other members in the family who can be hepatitis B. The other high risk subgroups are people living with HIV, all pregnant ladies, people who are on long-term hemodialysis, people who are receiving immunological products and biological products, people who are going to go for solid organ transplant or for bone marrow transplant. So these are certain categories who are at high risk of viral hepatitis, mainly chronic hepatitis B and C, who should be tested for this virus in a proper way. Now, what are the risk factors? I already mentioned the risk factors for contracting viral hepatitis for hepatitis B and C. They are mainly bloodborne viruses, and it is mainly vertical transmission for hepatitis B and use of unsterile needles and syringes in IV drug abusers for hepatitis C. Now the next question is it safe to have children who are infected with chronic hepatitis B? It is absolutely safe to have children. There is no problem in having children if you are infected with chronic hepatitis B. It is only important to show to a liver specialist who can then guide you regarding testing for your partner, vaccinating the partner, and if you are infected with chronic hepatitis B, testing whether you need treatment for chronic hepatitis B, using medicines to suppress the virus in your body. And once the virus is suppressed in your body and your partner is vaccinated, then definitely family planning can be done and you can have a children. Also, proper monitoring during pregnancy is important, and as I mentioned earlier, vaccination and immunoglobulin to the child immediately after birth is important in those who are having mothers who are hepatitis B positive. Now, can hepatitis B be treated during pregnancy? Definitely it can be treated. Tenofovir is the drug which has been shown over a period of many years of trial to be absolutely safe to be used during the second and third trimester of pregnancy. So again, it is important to be referred to a liver specialist who can assess the pregnant lady and decide if treatment is required or not. If the treatment is required, definitely tenofovir is the drug which is been approved for pregnancy use for chronic hepatitis B, and it can be used during pregnancy. What are the advantages of treating hepatitis B and C? The advantages of treating hepatitis B and C are unparalleled. Number one is, if you are treated timely, you are saving your liver. You are preventing your liver from going into end stage liver disease, liver failure. You are also cutting down the risk of developing liver tumors. So these are unparalleled benefits, and definitely there is no doubt that hepatitis B or C, once diagnosed and if required, should definitely be treated. So friends, I hope that I have tried to make the thing simple for you and understand the aspects of hepatitis, various aspects of viral hepatitis, and why we need to treat. And the most important thing is to get tested. Any abnormal LFT in health checkup, you should get tested for hepatitis B and C. High risk group should be tested. Once we test, we find those missing millions, and once we find those missing millions, we can link them to proper care, proper management, proper surveillance, so that we can save many more lives. I thank you all.